Good evening. My name is Roary, and I serve as UPO's Youth Services Director. Welcome to UPO's fourth annual Equity Forum. Our previous forums were on education, affordable housing, and bridging the digital divide with transformation, equity, and innovation. All of these are critical to UPO's mission to unite people with opportunities. We tear down barriers so people can build themselves up. We transform families for generations by helping residents reach their full potential, become self-sufficient, and thrive. Today, we bring together 4 inspiring leaders to share their insights on how to find, keep, and nurture a healthy mind. You will discover resources, learn action steps, and you'll see the bigger picture. The pandemic has accelerated the mental health crisis in the district and across the country, so we need to act. That's why UPO directed funding from the CARES Act to give mental health counseling to district residents in collaboration with the DC Department of Behavioral Health. And as UPO reaches our 60th year, we continue to use these equity forums to spark new innovations and improve social conditions. For example, today, we're excited about dragging behavioral health out of the shadows and into the light. Now, it's my privilege to introduce our moderator, Dr. Mary Roary, Director of the Office of Behavioral Health Equity for the U.S. Department of Health and Human Services, Substance Abuse and Mental Health Services Administration. Dr. Roary is a public health epidemiologist who focuses on infectious and chronic diseases. She is also an adjunct professor at the Catholic University of America. Her goal is to become an influential champion of eliminating health disparities by identifying and implementing data-driven best practices that promote health, equity, and wellness. Please join me in welcoming Dr. Mary Roary.
Wow, good evening. Thank you so much. I hope I can live up to all those things. First, I would like to thank my distinguished panel members, and I would also like to pause to do 2 things tonight. Number one, we celebrate you all. We're nothing without you. So the first thing we need to do is give you all a round of applause for all the work, all the hard dedication driven, your attitude to be an impact of change. That's what we need. And so we want to thank you. The second thing we're going to do that nobody expected, but we're going to do it. We're going to pause here for 30 seconds to honor all the people that should have been here had things gone a different way. So if you would all just pause with me, 30 seconds, please. Thank you. Okay, now, thank you all for honoring those who are not here with us, but we're not going to lose anybody else. And that's why we're here tonight, because we care. You're going to hear from wonderful people that I can't even touch. They're untouchable, y'all. They're outstanding. So don't change the channel. Don't get nothing to eat. Don't worry about anything that's going around. You just need to focus with us for the next hour and some change. If you have any questions, please put them in the chat box. In fact, I invite you all to put where you're from tonight in the chat box, what organization that you may be representing, where you're from, what part of the country. Please put that in the chat box. Also, we're going to be answering some tough questions, but we also want your questions. It's all about you. And hopefully what we share with you tonight will continue to keep that fire in your belly to keep going, right? That the fight is not over. And when you lose that fight, you will pass that torch on to someone who will carry that fight off while we're gone, knitting, playing golf, and doing some other things that we need to catch up on because we can't always do this. We need you all to step up and do it. So we're excited to be here tonight. All right, so here's how it's going to go. I'm going to ask the panels some really tough questions. They're going to tell you who they are, where they come from, what they love, what they like, what they're working on, what they're researching at the time. So they're going to do their own introductions. Also, I need you all to do me a favor. If there is a term or a word or acronym that you hear tonight that is not familiar to you, you put it in the chat box. What was that? So that we can make sure that we are responsive to you, because it's all about you. So with that, I'll get started. All right. How do you define mental health equity and why is it important? Dr. Stevenson, you are up first. Thank you.
Thank you, Dr. Roary. Hi, I'm Dr. Howard Stevenson, and I am the director of the Racial Empowerment Collaborative at the University of Pennsylvania's Graduate School of Education. And I am interested in how do we give young people and families, particularly of color, how to navigate the stress of racism, not only in structural spaces, but also, and that is in systems like justice, health, and education, but also in face-to-face encounters. We find a lot of things go wrong when people are frightened of Black and brown people, not just people or adults, but children as well. And so navigating those proximal, in-your-face moments to handle them is some of the work that I'm interested in. To answer that question, the idea of health equity, mental health equity, why it is important is because your emotions, your thoughts, and your body are all synced up. Whatever burdens one usually burdens the other two. And in the same way, whatever supports and heals your mind, then your body and heart will usually follow. And what people don't really understand when we think of mental health, we only tend to think of it regarding our thoughts and our thinking and our minds. And in fact, we know for centuries, we've known that the best way to heal the struggles that we have about how we think about ourselves, how we think about our people, our community, our culture, is eventually going to affect how our body functions, how we breathe, and how we take care of ourselves, and how we feel about the things that are happening in our lives. So it's very important that we understand that those three are connected. Secondly, it's very important that we understand that in the history of enslavement in this country, because of racial discrimination, Black and brown people have had to carry an extra burden based on their difference. They've been treated very differently when it comes to access to resources and education, and the lack of access to excellent education, competent healthcare, reasonable and ethical justice adds even a greater load when you look at other communities, particularly white families and communities in this country who don't have to endure the burden of discrimination. Our research and others have demonstrated that your mental health will suffer as a function of those systemic and in-your-face factors where people treat you as if you are not human. And so many of the work of this panel is how do we give more access, get more access to the resources and the healing services that everybody needs, that other people get that Black and brown families do not. So mental health equity is important because it affects everything in our lives. And frankly, it affects our children's lives. And if we look back at our grandparents and our great-grandparents, we can see a link between their mental health and their ability to access and care for themselves and who we are today.
Well said. Thank you so much. All right. What is the intersection of mental health and behavioral health? Dr. Barbarabazron. You're on mute. We want to hear everything you got to say to us. Thank you.
Okay, good afternoon, everyone. I'm Dr. Barbarabazron. I am the director of the Department of Behavioral Health within the District of Columbia. And I'm really delighted to be here today. And as I start, one of the things that I would like to say to everyone who is participating is it's so important that we mind our mental health, particularly now during the time of the pandemic, which is impacting all of us. However, I want to also emphasize something that Dr. Stevenson said before, and that is that as we think about mental health, we have to think about the fact that that involves our body, mind, and our spirit. And we can't leave any of those elements out as we think about our mental health. We within the District of Columbia really are focused on behavioral health, which really describes that connection between behaviors and the health and well-being of the body, the mind, and the spirit. I think all of those things are important. And all of those things and health equity really intersect our behavioral health. One of the things that Dr. Stevenson talked about earlier is the fact that access and quality of care are both important elements in terms of moving to mental health or behavioral health equity. Within the District of Columbia, we really understand the economic opportunity, the physical environment in which one lives, works, and plays, things like housing, like the environmental quality, the fact that you're in a food desert, the fact that you don't have proper recreation, the fact that there are safety factors out there, and the social factors that impact all of us really have to be addressed as we move to behavioral health equity. I just want to quickly highlight a couple of the things that we are doing within the district to advance health equity. I think we are very, very fortunate to have Mayor Bowser at the helm as our mayor. She continues to make, for example, a $30 million investment in supported housing, which is one of the social determinants of health, to ensure that over 2,000 residents have proper housing and a safe environment. In addition, supported employment, here again, one of those factors that's so important, having a job, services are available to any individual with a behavioral health concern within the District of Columbia, and hundreds of people within our district have really taken advantage of our supported employment program. We also are really addressing that safety issue. Safety is a factor in behavioral health. And we have mounted Building Blocks DC, which is a collaborative effort across the District of Columbia. And through Building Blocks DC, the mayor has targeted the vulnerable people in 151 block area to ensure that they have the proper services and supports to live in a safe environment. And this is critically important. So as we talk about these things, we can't just put behavioral health over here. We have to really look at it within the context of the social determinants in health and the environment and that relationship between the well-being of the body, the mind, and the spirit.
Well said. Thank you so much. All right. What are the structural determinants of mental health? Dr. Lisa Kakari-Stone, you are up.
Thank you, Dr. Roary. Thank you for reaching and touching so many of us. Your spirit, your enthusiasm, and your leadership never go unrecognized. I'd like to thank the United Planning Organization and all of those who are honoring the tradition on the weekend evening coming up of Dr. Martin Luther King. And as we enter the day of racial healing and health equity for the United States, for tribal communities, for many diverse communities. Following Dr. Stevenson and Dr. Basson, I just wanted to highlight a couple health equity definitions of mental health. We also, going on the holistic approach, it's critical to include earth, land, body, water, that we are interconnected with the climate, with our earth, with each other, and that mental health is really dependent on the health of all. It's dependent on the notion that we value all human beings, that we do not have a society that concaves in our services, our healthcare system, or in our policies or practices, or in our community, that we cannot cave to the notion of a hierarchy of human beings. I think that is the utmost structural determinant of mental health. When we look at food insecurity, we see that now even more so with the COVID-19 pandemic impact. Poverty, the lack of access to resources for health and well-being and mental health historically across generations. Discrimination and racialized violence. Lack of opportunities for employment, geographic and social isolation. We see with the COVID pandemic, many of our BIPOC communities are living in crowded conditions, overcrowded family units, for example, on the Navajo Nation or in the colonias of the border communities. Children are home now trying to learn within the pandemic, and it's difficult with the digital divide. These are determinants of mental health as people try to seek services and are isolated and are at home. Many might not be able to access telehealth. We also look at the pre-existing conditions that plague the moral fabric of our country, of tribal communities and other diverse communities and localities in the United States. The Poor People's Campaign and other social movement exposed pervasive poverty and racism and called for a radical redistribution of wealth, land, and rights. This determines our health. The egregious murder of George Floyd, as well as racialized violence on other Black African American communities, Asian Pacific Islander communities, Native American women going missing and being desaparecidos on the border area, particularly transgender and multi-intersectional communities. We have to raise the consciousness that mental health is more than the mind. And I want to talk a little bit just as I end and we go into another conversation. How do we tackle the rising tide of racialized discrimination in this country and tackle mental and holistic health at the individual, institutional, and structural level? We start with our face-to-face interactions with each other and reinstate cultural humility and cultural respect in our service system, but also between communities where we do not punish people for their social conditions, for their family conditions. I was trained as an LMFT, licensed marriage and family therapist, and I have continually to swim upstream, working in the behavioral health system in New Mexico, the urban communities of Chicago, serving Latino communities and neighborhoods, and now statewide and in the border region. And what I see is intergenerational trauma due to these structural determinants, and what we call in Spanish and from a traditional medicine approach, from the Mexicano tradition of healing, is soul wound. And together in this conversation, I hope we can get to some solutions and how we think about healing and building back better, but know that resiliency and grit have so much of a bandwidth left. People need to reinstate that bandwidth and that grit, and our service system can help us with that. Thank you for that time.
Thank you. So I would like Dr. Barbarabazron and Dr. Stevenson to respond to what you just said, Dr. Kakari Stone.
Certainly, I can tell you, first of all, I am in total agreement with what you say. And I think that we underestimate the impact of the microaggressions that Brown and Black people experience every day as a part of their daily environment, and how that impacts our mental health and our overall behavioral health. The other thing that's really important is I think that we have to think about one of the issues, which is related to access to care. Care has to be accessible and acceptable in order for people to get into care. And I think that one of the things that we have to really remember is that lack of culturally competent care is a problem. We can't use the Eurocentric model of treatment and assume that it is sufficient for people of color. Culture matters. Culture plays a significant role in the manner in which people manifest symptoms, how we cope, our willingness to even accept treatment, and how we move towards balance and wellness. We have to look at how are we incorporating natural healers. I think Dr. Stone was talking about, the role of like the curanderos or other, our ministers. Within the Department of Behavioral Health, we work very closely with the faith community because we know that people within our community need that support, and that needs to be a part of how we approach the provision of prevention, intervention, and treatment services within our community. So, I'm in total agreement. I could go on for a long time, but I'm in total agreement. And I just think that we need to really think about how we begin to turn the system on its head, literally, and think about how we begin to reshape our manner of doing business. Everything from how do we conceptualize sick and well? Mm-hmm. How do we do that? Where do we begin in the treatment process? Does everybody have to go through this long 1-hour assessment of some questions that may or may not be relevant? What do we do? How do we make this low barrier, accessible, and culturally competent to meet the needs of the people that we care about?
Thank you. Dr. Stevenson.
Oh, I was very excited by both my colleagues' comments, and particularly Dr. Bazron reminding us about how work matters in our mental health, and that we often forget not having access to gainful employment can affect, I don't know how people, not around wealth, but also how do I feel about myself as contributing to my family? And those are mental health issues. And I appreciated Dr. Stone's connection to how the body, heart, mind, and soul are also related to the earth, the air, and land. That we are, you could argue that in dehumanization, white supremacy, poisons our climate in ways that leave us all in jeopardy of how we breathe and how we walk and how we engage each other. So I love that connection. And I would just say the point around, there's a grand tension between westernized and culturally indigenous methods of healing, back to what Dr. Bazron is saying around healing versus sick. And I think we need to open the doors. We need to have better conversations about why these methods are useful in cultural contexts and in communities. We ourselves have targeted natural healers, barbers in our communities. We did a study looking at barber shops and found very clearly that not only can barbers become excellent counselors to help and educate Black men between the ages of 18 and 25 around how to protect themselves in sexual engagements, as well as how to reduce the retaliation violence to partners, to strangers, or to friends. There's something about the culture of the barbershop that has a healing aspect. How many of us find ourselves with our beautician or our barber sharing stories that we might not even tell other people? And in fact, can we be open to these natural healing processes where there is demonstrated evidence that our cultural ways, the way the barber touches us. When you're in that barbershop chair, you are a captive person. So you got to listen, whether you like it or not. But in the process, we find that these men say to us there are very few places that we can go where 95% of the time, not only do we walk out looking good, but we feel good too. And so I love what my colleagues are saying. And if we get to the healing and the solutions, part of it is how can we embrace the culture that we grew up on to help this westernized world realize there are more ways to heal.
Thank you for that. Now add resilience. We don't play up the resilience we've had because we've been through so much. So I would like more research in that area. So if we're surviving, how is it, what is it that keeps us in this era despite all the turmoil? So we got a question from one of the panelists already. So we're gonna start there. It says, do your genes play or have a part in your behavioral health, such as alcohol, etc.? Dr. Stevenson, you're up.
This is not an area of expertise that I have, although if you look at research, yes, our genes matter, as well as in connection to our behaviors. There's interesting studies around what we've been talking regarding racial discrimination, that we can link now the pressure of being different in the world, or racism, to mortality for Black and brown people, and particularly Black men, that you live less longer on the planet if you've experienced racial discrimination at high levels and have no protection standing up to that stress and pressure. But we also learned that, and some of these are genetic studies, that Black men who look at other Black people as if they are inferior take even a larger hit to their mortality. It's something about, and these are studies around genes that say we can track the impact of discrimination, not only on ourselves, but how we feel about our own community. So I'm not an expert around genetic connections, but in the same way that we would think about body, mind, heart, and soul, we have to think about our biology in connection to our behaviors.
Yeah, I would like to say that there is, in fact, a body of literature that really looks at the whether or not individuals have any predisposition to any of the factors that you mentioned, substance use factors, for example, because of the interplay between the environmental factors and the genetic factors that we are that affect our daily behavior, our behavior. And so, yes, there is some link. To what degree is what, is difficult. And environment does play a big part in it, and that genetic predisposition. For example, we find in mental health issues, particularly when you're looking at some of the extreme psychotic disorders, that there is some predisposition based on what happens genetically, what your genetic makeup happens to be, as well as environment. So there is that.
Thank you. And I'll just add personally, I know that when you are a child of an alcoholic, that you'll either tend to crave sugar or alcohol. And unfortunately, in my family, my brother and sister, and may my brother rest in peace, craved the alcohol, and I craved the sugar. So it's real. It can definitely impact you. So thank you. The person didn't have a name with the question, so I just want to thank the person who submitted that question. And I also want to pause and thank you all for your comments as well. We're here to be here for you. This is bi-directional. Please, please, please do put your questions in the comment box, and I will weave them in. All right, here comes some tough questions. So in a series of discussions in 2020, Dr. Anel Prim, Senior Medical Director to the Steve Fund, discussed the overall impact of poor mental and social economic health and subsequent disparities in treatment for young people of color. What are some of the barriers and what measures must be taken to improve the mental health and behavioral health services to include emphasis early interventions, for example, Black men? So Dr. Kakari Stone, I'm going to start with you this time. We're going to mix it up. What are your thoughts, please?
Yes, thank you. My work right now is couched in the Southwest context, geographic context, rural, urban, Black, Indigenous, and other communities of color. And for example, and so I want to just highlight, I think, the area where I might be able to bring some points for our discussion and consideration. And I see the many 85 people on here that are probably experts of your, have many stories. So I just want to say I humbly share some insights. When we're talking about, for example, Latinx youth in New Mexico and looking at the trends, and again, I'm just representing a collective. I direct and I'm principal investigator with other PIs, principal investigators, with the Transdisciplinary Research Equity and Engagement Center funded by the National Institute of Minority Health Disparities. And we have several research projects driven by scholars of color with their communities. Several of the projects are focused on Latinx youth and running analysis of the youth risk factor behavioral system. It's a federal database. We found that young Latinas actually have the highest rate of depression and attempted suicide. This runs counter, and I'd like to hear my colleagues as you ask the question about Black men and valuing the mental health of Black men and men of color. This runs counter to some of that. You would think the opposite would be true. We also found higher rates of LGBTQ, lesbian, gay, bisexual, transgender, and other queer Latino youth in New Mexico, higher rates of suicide, anxiety, depression. This is critical because often we approach mental health and holistic health from a heterosexist approach, and we need more providers to have training and to work with queer young people. I also want to mention, as we've looked at the increased surveillance on communities of color, and I'll speak to immigrant dreamers, young Latinx immigrants who may have been born here, but families come from Mexico or Latin America. We're finding higher fear and higher exclusion, stress around being surveilled by not just the ICE, the immigration police, local police force, but just constant fear of just being in the community. This is a different type of what we call hyper sensitized surveillance that seeps into their daily lives. This human surveillance, increased fear and stress, has long-term effects, not only on their education, but on their social relationships and their ability to successfully feel like they belong in the US society. I'll end there, but I just really want to emphasize that sometimes we underestimate what anti-Latino political attacks mean to our communities.
Yeah, I'd like to jump in, Dr. Roary. And first of all, I'd like to really focus on, what can we do to improve access to behavioral health care services among our populations of focus? And, here in the district, we've made an investment of almost $7 million in prevention and early intervention services. And that includes services for mental health and substance use disorder. And I think one of the things that Dr. Stone said earlier, and that is getting these, or one of the people in the chat said, we really need to infuse these services within the communities. So right now we have 4 prevention centers, which are located within the community. They are places where young people go. They feel comfortable there, and they can get support there. We also have place services in early childhood development centers throughout the city. And that's important, those consultation and support services, as well as having school-based behavioral health available in every public and public charter school within the district. I don't want to overlook the fact that we have to also make sure that we have trauma-informed care available, and we talk about what that looks like, and so that individuals who need it can get it. And prevention, early intervention, and then the access to services when you need it. Same day services, so that it's kind of low barrier. During the pandemic, we actually created a new service, which service strand, which I think is really important. And that is that people do not have to sign up, like go through an assessment and so forth in order to get mental health services within Columbia. They can get 3 one-on-one individual services from a licensed clinician by calling our Access helpline. They don't have to give their name, they don't do anything. And they can call 1-888-793-4357 and immediately access that care. And I think these are some of the kinds of things that will help improve access and address the needs of Black males and of young people. So who don't want it, they don't want to be called, I have a mental health problem, but they need to have that access and understand that it will be confidential, and they don't have to give any information, but they can get the care that they need. I think that's really, really important. And we have expanded those services in schools, quite frankly, for our young people.
That's awesome. Can we get that number again slowly so I can put it in the chat box? You said
1-888-793-4357, or the easy way I remember it is 1-888-7-WE-HELP.
Okay, I
That's
like that.
way to do it. But I think that members of the community should know that service is available. It is free of charge, no charge, and you get that one-on-one care.
Thank you. And I put it in the chat box. Dr. Stevenson, you're up, and I'm going to pick on you a little bit. There was a request in the chat box to learn that can sports be a part of helping with mental services and involving recreation centers and sports. And so, I'm going to pick on you and ask you to share a little bit about play. Thank you.
Thank you, Dr. Roary. I actually, first I want to say the part of the natural healing conversation means that we have to trust the communities and the cultures of those communities and the leaders of those communities to understand the needs of the folks who are struggling from the cradle to the grave. And so when I mentioned the Barbershop Project, 2 other colleagues, Dr. Loretta Jamat and John Jamat, we were all colleagues in creating that project, and we hope can continue. But the project that Dr. Roary is related to around physical activity and sports, since 2000, actually since 1998, we have a project called Play, where we started in a discipline school in Philadelphia, servicing up to 400 boys between the ages of 8 and 19. Where we use basketball as the stage upon which we help them navigate face-to-face stressful encounters. Many of you understand that sometimes you can play a basketball game and sometimes it turns into a fight. And that's not just true for Black and brown boys on street corners, neighborhoods. That's true anywhere in the country, across race and groups. Sometimes in the context of play and movement, people's emotions come out. And what we've learned is that we can help understand what children struggle with in terms of conflict by watching how they navigate the stress of being on a basketball court, whether they are talented or not talented. What we learned from that project, which we call Preventing Long-Term Anger and Aggression in Youth, is that if we can teach young people in the middle of a stressful encounter while you're playing to navigate, emotionally regulate, and make good choices, that can generalize not only to the classroom, but also to the street corner. And so I'm putting in the chat a link to the play project for people to understand how we've done that. It's now being implemented in several cities, and particularly in New Orleans, where the Center for Resilience is doing a marvelous job. I'm not only taking the play principles on the basketball court, but in video games. Many of you know that in video games, our real selves come out. And in many respects, the need for self-regulation, emotional regulation, but also the appreciation of cultural style and how we represent ourselves are very necessary there, so that we don't overreact or underreact, which fits right into Dr. Bazron's world of behavioral health. So in many respects, can we use sports and physical activity for boys, girls, and adults to navigate the stressors of life, as well as interpersonal conflicts, including partner violence? The answer is yes, we can. And the question is, can we double up on recreational, health, and learning services all at once and not separate them as a way to think about what people need wherever they are, right? It would be nice if we could go into a psychologist's office, but that's just not reality. We've got to bring the mental health services where the children and the people are.
Okay, speed round. Dr. Bazron, you're going to be up first. So, mental health experts highlight systemic policies as factors to social and racial injustice that affects the declining mental health of people of color, especially those who are low income. What responsibilities do federal, state, and local governments have to invoke new legislation that reverses the social norms that have neglected these communities? And Dr. Stevenson and Dr. Kari Stone, you just hop right in as soon as she responds. Thank you. Speed round though, speed round.
Well, I think that certainly federal, state, and local governments all have a significant responsibility to address this issue through legislation, through policies, through changes in practice. Mayor Bowser, in her leadership role, really reflects, I think, that deep commitment to our values and the DC's values by maintaining those investments that will provide all residents with the opportunity for equity in care. And I think that that's really important. And during these unprecedented events in our community, it's been even more important. One of the things that she's done, and I hope everybody is aware of it, is she has established for the very first time an Office of Racial Equity, which is led by Dr. Amber Hewitt. And so as a result of that, we as government will be held accountable for addressing the issues related to health equity. We'll have to address it related to our policies, our practice, and we will have to have data to support what we're doing. I think that that is significant, and that is a significant move. The other thing that I think is important is that we have policies in place right now where we are investing, as I said earlier, in the social determinants of health. I don't think it is a minor event that we have $30.5 million invested in maintaining supported housing for 1,700 residents with mental health needs. That's just within my little budget. And of course, the money that I talked about through the mayor's initiatives within DHS. And we also have supported employment and other things that address the social determinants of health. We have a responsibility to turn this thing on its head. And the way we do that is through policy development that changes behavior. For example, when we're writing a request for proposal, what are our requirements for that provider? How does that relate to health equity? These are some substantial and some specific and some concrete actions that we can take to make a difference.
Thank you.
Go ahead, Dr. Stone. I think, do you have some thoughts?
Thank you, Dr. Stevenson. I appreciate. I just want to mention that we can't forget about the power of tribal policies. Our tribes across the North America here within the United States area are sovereign nations. I'll give one example. I don't want to name them. They prefer not to be named in public without permission. But as part of our Transdisciplinary Research Center, we have a multi-generational project that's driven by a local tribal community. And in a time of COVID, tribes have been the most responsive of bridging the digital divide. I think there was a question about access to telehealth for youth during the time of COVID. They were able to implement within their own sovereignty, immediate connections and internet access and Wi-Fi hotspots within their community. Some of the intergenerational, culturally centered work is between elders and youth. And I want to just highlight that that is an immediately policy impact. Just a quick mention, I think deeply, I'm a policy person. I started in the 80s as a practitioner in mental health, but I've keep swimming upstream, that we really separate and acknowledge the power of both universal policies for all that raise the boats and opportunities to access to services and resources, and targeted policies and practices for particularly distinct BIPOC communities in different geographic areas. One universal policy is we really need to think about the social media campaigns that reduce the stigma of mental health. Many of our BIPOC communities, we hold those because we have culturally driven values. I'll speak just from the Latino community. There's shame or vergüenza around depression or anxiety, and that we're taught not to seek help or air our dirty laundry outside the home. We need to reduce that stigma locally and nationally at all levels of government. And then also having a sense of promotion and safety and belonging as a universal policy, non-discrimination laws, starting as what Dr. Bazran mentioned, actually just starting with naming, having statements on anti-racism laws in a state or localities. I think also guaranteeing universal coverage for all children so that no matter where they live, their families and the people that care for them, including grandparents who are raising them due to, for example, the opioid crisis, might be able to have access to health care and coverage for those children. We also need to enforce the Mental Health Parity Act that was passed under President Obama with the Affordable Care Act. I think targeted policies locally, statewide, also look at outreach and enrollment, for example, with promotores de salud. Local counties sometimes have larger budgets than a city might have. Anti-bullying, zero tolerance policies in the school system. And I want to just mention just finally, as we think about more targeted policies, we think about policies that really do promote resiliency and policies that really foster building community-based practices and investing so that they're bumped up to evidence-based practices. And sometimes communities don't have the bandwidth for organizations like SAMHSA to recognize them as an evidence-based program. And we need to have that dedication to helping them get on the ground so that they become embraced. Thank you.
Go for it, Dr. Stevenson.
Yeah, I mean, you could go on to the next question. I think
They covered it. They slayed it.
Yes,
Okay.
absolutely.
Okay. Well, let's throw in one from the chat. How do we prevent teen suicide?
Well, I mean, I would throw in that, you know, it is important to understand the trends of teen suicide. And one of the things, as I was learning and training for the last 30 years, it was bizarre for me to see in the last 10 years an increase in Black not just teen suicide, but child suicide at a rate in the last 10 to 15 years that we have never seen for for centuries. So the idea that times they are changing and they're affecting our young people and how they think about themselves, how they feel about hopelessness, how they want to deal with hopelessness is not a small issue. And that's not just true in Black community. So I think the strategies that we've been talking about, many of them are helpful in managing a host of issues around mental health. And they address identities specifically. So the notion that you can have a universal program that doesn't get at the particularities of why someone might feel hopeless. If I think my sexuality is a target of hate, we know that in some communities, being LGBTQ, the bullying is going to be much more excessive than for other groups. And that also means the health services have to respond to the burden placed uniquely on that community, different than other communities. So a universal approach might not address why in our bullying programs we need to have strategies that understand why this hate is coming at LGBTQ youth or Asian American youth in the last 2 years. We have to be nimble in how we think about these services. And I would just say one other thing. When we were talking about the Play Project, recreation and physical activity is a counter to depression because it's engaging other parts of your physiological health system. And many people don't realize this, Dr. Roary knows this, that we actually have a way to train folks in some of these evidence-based or evidence-promoting programs. And I leave in the chat, SAMHSA has the National Network to Eliminate Disparities. Communities in different cities can apply for getting training in not only the Play Project, but other projects targeting youth from different communities of color that will eventually, in my view, address some of the issues around not only teen suicide, but alienation, racial discrimination, and the stress of just being different in schools and neighborhoods. So what this means is that a group in a community from justice, from health, from education can pull together, commit an application and come to get training on how do I take these services that are culturally responsive back to my neighborhood. And so I'll just end there.
And I would just like to throw in that a caring adult can make all the difference in the world in terms of suicide prevention. And one of the things that we know is that, for example, within schools, to have a school-based behavioral health program where there are caring adults who can connect with kids does make a real difference. And I think that it's important for us to think about the fact that in terms of suicide attempts, suicide ideation, Black girls, as well as members of the LGBTQ community, really are suffering. And the data is going in the wrong direction for that population. So we do need to make sure that we connect those young people to caring adults, to mentors, to big brothers, to big sisters, to that teacher. I know when I was in school, having a connection with that special teacher made all the difference in the world. And that's who you went to see in the morning, or you stopped by at the end of the day to say just hi, or you talked about whatever. And I think that you can't overemphasize something that simple as having that real special adult.
Dr. Kakari Stone, and I'm giving you 20 seconds to respond. Y'all just forget the speed round. I did say the word speed round, but okay, come on.
I think my colleagues, Dr. Bazran and Stevenson, answered it very thoroughly. And I think having a caring adult, somebody who makes a difference, is a lifesaver.
Mm-hmm.
And I just want to add love. We need more love in the world. And so we need to tell all our children from the second they come out of us that they are beautiful, they are special, they are wanted, they are loved, and then nurture them in that. And then they need to see it in the church, in the school, because we can't do it by ourselves because they go places. They hang out with their friends. We tell their friends when they come over. Look, love is all we about love. We ain't fighting. We love. We're loving up on each other. So, and I want to say one other thing. I want to say that the best prevention or the freest prevention is exercise. If we would just move, right? That would deal with some of that mental health issues, the substance use disorder, because we're bored and we ain't got to move. Go move. So I think that we have some things that are very simple. We need to get back to the simple way of life to be able to enjoy and sustain the life that we're in. Okay, speed round. You all are getting 20 seconds to answer these questions because I want to us to respond to one of the questions in the chat box, and then we're going to turn things over and we're going to thank everybody. All right. If there's no data, there's no problem. What are some pitfalls in using monolithic, bulky, imposing data that do not effectively address policy, or more importantly, funding connected to groups that have been historically marginalized, including Black and Brown communities, rural communities, undocumented communities, homeless communities? I could go on. So what are some of the pitfalls? All right, I'm giving y'all 30 seconds. I'm getting out my cell phone and I am timing you all. Who wants to go first? Just jump in.
Well, my comment is just pretty plain: garbage in, garbage out.
Thank you so much. I appreciate that.
You know, you have to have valid data upon which to make decisions. And if the data is not valid, it's not of any use.
Thank you so much. Dr. Kakari Stone?
Yes, I think we have data. We have, as we say, we're data rich, information poor. We need to work with communities and the social service integrated system, as well as policymakers, to produce information, fact sheets, to visualize and manifest what's going on in the communities and combine data metrics and data analytics that's not used as surveillance against our communities, but used as a way of purveillance, and that we advance what we know about particular geographic areas. So we have place-based type of data, democracy efforts to use local data with data collaboratives, and that we also include story from young people and story as data, because their voices and their testimonies tell us the most of what we need to change. Thank you.
Okay, 29 seconds. Dr. Stevenson.
Yeah, Dr. Stone just took it out of my mouth. Storytelling is an underrated way to get data, and particularly in Western science, we haven't done a good job around historical trauma. We don't connect historical trauma to contemporary health challenges. And so storytelling becomes a way that you can connect the past to the present, and it's underrated in getting good quality knowledge of the larger context of which health and mental challenges exist.
Thank you so much. And with that, I'll just say that we did have one more question in the chat box, Dr. Thomas, and I'm going to read it, and so maybe you can incorporate a response. How do we address special needs in regards to mental health in Black communities that may result to homelessness, hopelessness, bullying, and lack of services in school and legislation? And then I just want to add one comment. Data, 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 like location, location, location. If you all don't walk away with nothing else, please remember the importance of data. When we collect data that has been valid, that has been tested, either it's qualitative or quantitative, so numbers or words, right? Then we can take that information to the Hill. And guess what the Hill do? They'll write us a check to start chipping away at the problems. It won't be all the money that we could need, but at least it's a start. So if I can implore you all to please make sure you're paying attention to data. When someone asks you to collect data, they're trying to actually help you. So I'll pass that over to you, Dr. Thomas. I want to thank my panel members. They are stellar. I encourage you all to Google them and you will find loads of information about them. And I want to thank the organizers, and Joe, I know you're somewhere, for inviting us all to be here. You know, we could have stayed with y'all until midnight talking about this, but our time is up. Thank you so much. And woo.
Thank you so much, Dr. Roary. And if you would allow me to, because you have been such a stellar facilitator, and we know that you have a very strong background in this area, I'm actually going to pivot that question to you. And how do we address special needs in regards to the mental health and the communities of homelessness and bullying and lack of services? I'd love to hear your take on that.
Stop it. Stop it before it prevents. The minute their baby comes out, they know that they are loved and cared for. The mom knows where the services are that's stellar or that's equitable, that what her counterparts are getting, she's getting. We have got to equal out the playing field. And God forgive me for saying this, if Bob, the white man, is the gold standard, then the rest of us are the gold standard, then treat us like the gold standard, right? And so that's the first and most important thing, to surround, to not work in silos. What we've been doing all along is working in silos. She doing her thing, he doing his thing, they doing, no. We need to come together and pull those resources together. And I promise you, we will not fail. We will decrease suicide. There'll be no more suicide. We're aiming for zero suicide right now at SAMHSA. We have a 988 that's coming out. It's a line that you can call and get the help that you need. Now, look, is it just for white people? It's for all people, because I made sure that when we presented at the National Academies of Science, Engineering, and Medicine, that it was for all people, Hispanic, folks with disabilities, Blacks, African Americans, children, you name it, homelessness. So we have got to just pull our resources together, continue for you all to have forums just like this so that we can have that bi-directional conversation so that we can excite each other to come together. I put tons of resources and emails and links and stuff in the box, and that's what we need to do. Sharing is, in fact, caring. Thank you.
Thank you so much, Dr. Roary. You were an absolutely stellar, energetic facilitator, and I cannot thank you enough for the time that you have spent with us today. I thank our D'Angelo Roary. I believe he'll be a Dr. Roary sometime in the future here on our team, for all of his efforts in convening this wonderful panel together. He and Josephine Boukir and their exceptional work with their teams to make this happen. Dr. Bazron, Dr. Stevenson, and Dr. Kakari Stone, again, thank you for bringing your insights. You know, oftentimes when we're talking about mental health, it is a hard conversation, because while we work with people in poverty and how it begins to present itself early on from childhood, and then we see it often in adults who have carried burdens that they didn't know how to articulate. And so I thank you for bringing some real language to that, and being very fearless in your conversations about how people carry the microaggressions in their spirit. And so that when something very small comes along, all of this pent up energy and anxiety and angst is there, and then it comes out in all of the wrong ways. And Mr. Stevenson, I have to tell you, your conversation about the barbershop, we do know that that is sacred ground for many, many Black men, and using that as a place not only for physical health. I had a great uncle in my family who would do blood pressure checks at his barbershop. And so to know that that is also a place for physical and mental health, and people walk out feeling better. It's those sorts of conversations that seem so elementary when we think about it, but it can turn a life around. It often does turn a life around for people in the community to have this sacred and this safe space to be. Dr. Kakar, you talked about dealing with the stigma of airing dirty laundry. And so oftentimes we, in families, it's like a pressure cooker. It's pressed down. It's something that you don't talk about, whether it's being LGBTQ, abuse that may be going on in the home, but ensuring that particularly our government agencies that are reaching out, that they make sure that they use the language and, quite frankly, the images that let people know you are not alone, and this is a safe space for you to come and receive some support. I want to thank those who joined us this evening. And you know this is important because we see, or I saw from the chat, people from all different walks of life, both practitioners, those who are working here at UPO. I saw we had someone from California called himself Sports Dad, who felt it important to be here and to receive this information this evening. So I am heartened that we're all coming together and recognizing that mental health, and Dr. Bazron, you gave me an education and made sure that I learned to say behavioral health, because that mental health then dictates behavior, that it's no respecter of persons. And so whether it's our customer base or, and I want to put this out to the people who have joined us on this panel, or who are the audience on the panel, think about the person in your life who you love the most, that you would do anything for. It may be a parent or a spouse or a child. And then as you think about what sacrifices you are willing to make for that person, how you're willing to nurture that person, I'm going to challenge you and charge you, turn it on yourself. Do that for yourself. Love yourself, as Dr. Roary said. And I think that will be a giant first step towards good mental health, not only for yourself, but those who are around you, because in loving yourself, you allow people the space to love themselves as well. I put some information in the chat. You'll be receiving more information regarding the different mental health resources that have come up in the chat box, but I will also share with you that one of the things that UPO is doing with some of the funding that we have is making sure that you're able to get to counselors. We recognize that particularly for our children who've been away from their normal social activities, whether it's in school or with sports, that's been stressful, and it's been stressful for the parents and families as well. So you can give us a call at 202-231-7992. 202-231-7992, and we will get you connected with those mental health counselors. I again thank you all so much for being.
Dr. Thomas, 202.
Oh, sure. 202-231-7992.
Okay, thank you so much.
Thank
I'll
you.
put it in the chat box, everybody.
Thank you so much. And again, I encourage you all, love yourselves, love one another, stay safe out there. Please, we are living in a world of a lot of anxiety around COVID, but take care of yourselves. But Dr. Kokari Stone, you look like you wanted to say something. Did you? Okay. Take care of yourselves, and we cannot wait to see you at the next forum. Bye-bye.